Policy, and also the co-chair of the Canadian Association of Physicians for the Environment, and founding co-chair of the Ontario Climate Emergency Campaign on Sustainable Ophthalmology.
So thank you, and welcome to a lightning tour of our vision for a sustainable future, the Ophthalmology Toolkit by the Canadian Ophthalmological Society, supported by the Coalition. So we'll talk about a few of the key recommendations from the toolkit, as well as goals to amplify and apply the work. So ophthalmology has the highest surgical and procedural volumes in all of medicine, with cataract surgery being the single most common surgery in all of Canada and the world. And of course, we know that about 70% of healthcare emissions come from the OR. We do know in ophthalmology that more than half our emissions come from surgical materials. There's a strong business case for sustainability. So ophthalmologists have a really unique role to help decarbonize the healthcare sector. So let's look at, first of all, the fact that this is a first by a surgical specialty. Also that in this infographic, you see all of the modules represented in the toolkit, which reflect the emission sources in eye care delivery. And a big thanks to Dr. Kandasamy and the team at Peach and the Coalition for invaluable support, including these infographics. So every module includes key learning points, QI-based action items, resource links, and real-world examples, and will be a living document. So let's take a look at some of the key points. First of all, waste in ophthalmology is absolutely massive. So we want to target things like our surgical packs, procedural packs, disposable instruments, eye drops, and packaging. Unfortunately, my animations are not working on the system. There is transportation to be mitigated by using teleophthalmology, which we're definitely increasing, consolidating appointments for same-day diagnostics, which we have very high volumes, and our procedures like our lasers and surgeries where we do bilateral procedures same day. For rural patients, we work with our optometric colleagues in rural and smaller communities to reduce transportation needs. In terms of procurement, we apply surgical or sustainable procurement practices to surgical procurement for high impact due to the sheer volume involved. In terms of drugs and diagnostics, we can use these for multiple, there was a task force that made 3 specific recommendations for multi-dose topical eye drugs, and that these may be used for multiple patients until the label date of expiry, because before that we advocated for monthly changes of bottles, and that patients can bring home partially used meds from the operating room. In the OR, now again, it's not working here, the module on sustainability in the OR is our major module in the toolkit where we know we need to do better. We have a global gold standard in eye surgery at the Aravind Eye Care System, where we know that emissions from a single cataract surgery done in the US or the UK generate the same emissions as driving 500 to 800 kilometers per case. At Aravind, they have this down to just 23 kilometers per case. And so our emissions are more than 20 times higher, and we need to do better. So our module for the OR includes discussions of barriers to sustainable practice, patient prep and flow. We look at energy, water, and waste management, sustainable anesthesia, instrumentation and procurement, and also importantly, collaborating with industry and training our staff. So just a few key points there. We are moving towards eliminating whole body drapes for patients to adopt face drapes, for surgeons to move to reusable PPE such as gowns and masks. We want to switch from water-based to alcohol-based scrubs and promote multi-dose antiseptics and topicals. We of course want to emphasize reusable instruments over disposables. We want to use short cycle unwrapped instrument sterilization, and we already practice bilateral same-day cataract surgery when appropriate. And we also want to streamline our surgical paths, which has a huge impact as well. So when I approached the COS with this proposal for a toolkit, I had in the back of my mind the question, if we build it, will they come? So I went in armed with sort of a little marketing list of ideas to amplify and apply the work we're doing in the toolkit. So first off, we're already educating COS members across Canada. The photos you see here are from the first self-assessment program we ran at our annual meeting. We've also had dedicated time at a national COS webinar. We are going to be housing this toolkit on a COS-supported website, but have negotiated cross-promotion and posting with the Coalition, Peach, Royal College, Cascades, and also iSustain, which is an amazing international initiative. We are in process of doing an article for the Canadian Journal of Ophthalmology. We will develop a shareable library of materials to promote this in journal clubs, grand rounds across the country, and we are in early stage engagement with industry who have to be along. I'm happy to say that the project got an award from Choosing Wisely Canada, a grant, and we will be developing ophthalmology recommendations for CWC because these do not currently exist. And I'm happy to say we are planning a curriculum development with Royal College where we plan to translate the toolkit contents into an ophthalmology-specific planetary health curriculum for residency training. So in conclusion, eye care, especially surgical care, has staggering and preventable negative environmental impacts. Ophthalmologists have a significant role and responsibility to decarbonize the eye care sector to do our part. So thank you for listening.